Hi there, and welcome back. This is week 3 of this psychotherapy practicum, and today we're getting into something essential for any therapist in training, therapist, veteran, etc. And that's the topic of resistance. Yeah, we sort of touched on it on the tools for it last video, but now we're going to go a little bit more into deeper detail and in depth. So, if you've ever heard a client say, I don't think this is working, or I've tried therapy before, then you've already met this thing which is called resistance. But here's the truth. And this is something that when I started out, we didn't think this way, but now we know the truth is like this. Resistance is not a sign of failure. It's a sign that something important is trying to protect the client. And what that means we'll talk about. So in today's video, I'll guide you through what resistance really is. We'll talk about the 2 types of resistance in Team CBT model, how to disarm resistance skillfully, and also how to view resistance through the internal family systems lens, to see it as a protective part. Okay, let's start with the basics. What is resistance? Resistance is any behavior, verbal or nonverbal, that creates distance in therapy. It slows progress or protects the client. From what? From emotional vulnerability. Now, it might look like deflection, for instance. I don't really want to talk about that. It may look like sarcasm. Oh, great, another worksheet. It can sometimes take the form of disengagement. I forgot, I have an important meeting with my boss in another 5 minutes, or avoiding contact. Another common way is rationalization and over-intellectualizing. I've already read about that. I know all about it. Just give me the tools already. So here is where Team CBT gives us a powerful framework. Dr. David Burns defines 2 core types of resistance. The first one is called outcome resistance. This is a hidden no to the idea of change itself. My clients may say they want to get better, but in terms of IFS, there's a part of them that doesn't want. There's thoughts that come up that push them off of that. And why do these thoughts come up? Well, really the thoughts say that it might not turn out so well. There's consequences to getting better. For instance, if I'm no longer anxious, people might expect more of me. If I feel better, I'll lose my excuse to say no. If I'm not depressed anymore, I might have to face the world. And in Team CBT, we look at all of the positive and negative reasons why one might be for or against that actual change. What are the advantages and disadvantages of being anxious? What are the advantages and disadvantages of being depressed? Or whatever it is that the client is coming to you with. And with all of the cases, you and the client will learn to see that that symptom, that problem, that issue has become a coping mechanism. Sure, it's painful, but it's protective and keeps him safe in a certain framework. And then just imagine asking someone to give up something without acknowledging what it's protecting them from. This is what we call outcome resistance. The client resists the goal of the therapy, usually without realizing it. The second form of resistance within the Team CBT framework is called process resistance. This is when the client wants to feel better, but doesn't want to go through the process that you're offering him. It might be something like, I don't want to delve into those questions. Or, can we skip the emotional part? Or, you know what? I really don't have time to do any of this homework. Journaling is not for me. So, some people will look at this laziness or defiance, but it's not. It's self-protection. Maybe they've opened up before and it went badly. Maybe they were shamed or dismissed. Or maybe they just don't feel safe yet. In Team CBT, instead of challenging that resistance, we validate it. We use the disarming technique and empathy like we discussed, and we'll go on discussing. We might use a positive reframing tool or some other tools that are in that framework. And you might say something like, it makes total sense that you feel unsure about this process. I get it. It's hard. And it can be uncomfortable when it hasn't helped in the past. So it's important that you bring this up, and we got to look at how you're thinking about it and go into depths. I totally understand why you'd feel frustrated and doubtful. You put effort into these things that didn't help, and you're completely exhausted. And it doesn't feel right to keep on trying when nothing changes. But thank you at any rate for being open about that. And we've already talked a little about this in the last video, but I want to go a little bit deeper into the disarming technique from Team CBT. I've often mentioned that this is the most powerful of all the relationship communication factors. And the idea is pretty simple in terms of resistance. When the client says something resistant or critical or even hostile, we don't challenge it. We find the truth in it and recognize that truth. It doesn't mean you're agreeing with everything he said. But when you find the truth and acknowledge it, this diffuses attention and opens the door for trust. Let's look at a few examples. The client says, this just feels like a waste of time. It does feel like a waste of time. Let's look at that. And let's look at what's going on and the way you feel that this is really useless and possibly even feeling hopeless. You're not saying that it's a waste of time, but you are acknowledging that he feels like it's a waste of time and the feeling that goes along with it. So let's say another example. The client says, you don't get what I'm going through. In your head, you're saying, boy, what do you mean I don't get it? I've done other people. I know how this works. I know what she's going through. Now, that might go through your head. Have to look at that from your own point of view. But if she says, you don't get what I'm going through, you might say something like, I don't 100% get what you're going through. I haven't lived your life, and I'm not going to make believe that I know exactly what you're feeling. A lot of people could feel misunderstood, and it makes sense that you feel guarded with me. So the key is to let go of being right and focus on being connected. And when done skillfully, disarming doesn't just neutralize resistance, it transforms it into a doorway. Okay, now let's shift into internal family systems, or IFS. So where Team CBT gives us conceptual cognitive tools, IFS goes into the relational depth. More on the starts with the emotional and then works up to the cognitive. In IFS, the mind is made up of parts. You really have to listen to my introduction to IFS also. But in short, there's protectors, exiles, and the self. Every time resistance shows up, IFS asks us and encourages us to ask, or even better yet, to get the client to ask, what part of this client is stepping in to protect the self? That includes the client who shuts down when emotions rise. It includes the one who gets sarcastic or is avoidant. And of course, it also includes the one who intellectualizes instead of emoting and feeling. We identify these more often than not as protectors, that part of us which protects the self from pain or embarrassment. These protectors fall into two broad categories. Managers, who prevent pain by controlling and avoiding and are proactive to keep life as stable as possible. And then there are firefighters, who react when a large threatening pain breaks out. And that part of the personality, that sub-personality, acts through numbing or distracting or lashing out. All those things that most people are sorry that they did that after they've calmed down. Now, it can come out also in the middle of a therapy session. But these parts aren't trying to ruin therapy. They're trying to help the person. They just don't know any other way. As a therapist, your job is not to remove the protector, but is to relate to it. To get to know him or her better. When I say him or her, I'm talking about the part, not the client himself. So you might say, I'm noticing some hesitation here. Or maybe something in you is saying, this doesn't feel safe. And if that's true, I want to go at the pace that feels right. When something like that happens, we identify it as a trailhead because it will lead us to some place which is more important. But in dealing with the resistance, dealing with these parts that are coming up, dealing with the protectors, you have to see them, recognize them, and when they're respected, they relax. And that opens the door for healing, for empathy. This week, if you're actually working with me, you'll be role-playing a client with resistance. Or I'll be role-playing a client with resistance and you'll be role-playing a therapist. But throughout everybody's training, there are always a lot of role-playing because that's the best way of learning. So if you're not training with me, you'll still do role-playing. And what I want you to practice is, first of all, spotting the signs of outcome or process resistance, and to respond using this disarming technique. The disarming technique, the cognitive behavioral techniques can be applied to specific parts in the IFS lens. I want you to also to work on identifying the protective part. So remember, at any time. Slow down. Be curious. And most important, let your client feel heard. That's the key before you even try to help them with any change. And here's a challenge. Try combining the team CBT and the IFS approaches. Use team's empathy tools while honoring the IFS parts language. Sort of like, it sounds like there's a part of you that's been burned before, and it's not sure this will be any different. What is that part actually thinking? And then pause. Let that protector be seen. Let that protector be heard. Let that protector be acknowledged. I think there's a very important caveat that has to be acknowledged and talked about and examined. And that's the therapist. It's about you. Because we also have resistance. Yeah, we're going to talk at one point about countertransference, and that's really another word, another viewpoint of what that resistance is or comes from. But in terms of what we're talking about now, especially IFS, you just might have a fixer part that wants the client to change now. There's a part of you that says, I'm here to help and fix and do that. And you've probably seen that in a lot of other people. Now, why isn't he listening to me? He just wants to fix. He's telling me what to do. Or that guy who says, why would I even have a conversation with you if you're not going to listen to my suggestions? Those are fixer parts. They're very common. And we have that because we're dedicated to being helpers. On the other hand, you're also a worker. And you might have a performer part that wants to impress your supervisor or impress the client. And that can come up, and that's counterproductive. And that would be a resistance inside the therapist. Or you may have a part that feels rejected when you hear criticism from the client. And that can be very powerful and certainly not uncommon because all of these are normal. But being normal doesn't mean that they are actually helpful or productive because they can interfere with your being present in the therapy session. So when these parts come up and when these thoughts and feelings come up, here's some things you can say, some prompts you can say to yourself to bring yourself back into self with a capital S. To experience again and come from again that self energy. So what might you say? First of all, you want to identify who in me is reacting right now. And what is that part afraid of? Can I stay connected even if the client pulls away? Can I pull on my curiosity and confidence regardless of what the client is doing to me or what I think the client is doing to me? Therapist self-awareness is essential for responding to resistance without getting defensive. And when you track those parts and emotions and you gain confidence and skills in that, you offer a stable, compassionate presence. And that's what your client needs more than anything else. Okay, let's just wrap up. The basic idea here is that resistance is not an obstacle. It's a message. Team CBT gives us certain tools like the disarming technique, the 5 secrets of effective communication, the feelings and thought empathy, the reframing tool. IFS helps us to see the inner protectors, the other parts of us, instead of the problems themselves. And together, they help us listen, focus, join, and start where the client is. Because when resistance is welcomed instead of fought, then the work can actually begin. So, thanks for watching. I'll see you in the next video. If you're working with me, I'll see you in your role play, but you've got this, and it'll work.